Hey, what's going on, Facebook family? I'm coming to you live from we're in the office here right now, and I had a few minutes before my next patient to get my afternoon started, so I thought I'd pull out the old handy dandy microphone today and talk with you guys a little bit about some things that you can do that you may not think of if you hurt yourself, if you injure your back or your neck or you slip and fall. Because guess what? It is summertime right now, and I know many of you guys are headed camping. I'm headed camping this weekend with my family, headed to the beach. Maybe you got some weekend warrior stuff out there that you're doing, surfing, swimming, what have you. So I just wanted to take a few minutes today because I know this question is going to come up. It comes up every single day in my practice, and that is, what do I do when I injure myself? Or, hey, my back hurts. Should I be using ice? Should I be using heat? What can I be doing? What shouldn't I be doing? What things can I take, etc.? So I thought I would just jump on today and just have a little conversation around that. So the first thing that you need to try to understand or try to determine is, obviously the severity of the injury. Obviously if you think it's life-threatening or something like that, then you got to go to the emergency room. But if you think maybe you just pulled a muscle and you're trying to figure out, hey, is my back just tight or is it really injured? Here are some tips and things that you should know. And if you have questions, I would definitely encourage you. You can click and ask below. And while we're here today, I'll try to do my best to answer them for you. So the first thing that you have to determine is, if we're going to talk about low back pain, is this injury or is this just muscle tightness or muscle spasm? Now, if it's a muscle spasm or just blanket muscle tightness, the muscle will stay tight or spastic or spasm tight for a period of about 20 to 30 seconds. That's usually about it. Never will a muscle be tight for a period of minutes or hours or just holding for a certain length of time without releasing. See, muscles have two functions, right? They contract and they relax. That is it. They either go into full contraction or they go into full relaxation, my words, right? So when a muscle is in spasm, it'll be tight for a short period of time and then it'll relax. However, if there is injury underneath where the muscle is, so to a capsule, to a joint, to a tendon, to a ligament, to a bone, then the muscles will go into complete spasm and not let go. That fact right there is one of the biggest things that people overlook. They often think, hey, my back was tight. And I always ask, well, how long was it tight for? And they say, oh my goodness, but it was like 30 minutes, an hour. Okay, if that's the case, then we have an injury to the low back. This isn't a muscle spasm, but we have an injury. Now, if the muscle, if you came in or a person comes in and says, Bo, it felt really tight for like 10 or 15 seconds and then I relaxed and I went about and did my business, and then 2 hours later I was sitting and I went to get up out of the chair and it really tightened down again for about 15 or 20 seconds, then here's what I tell you. For those patients only, that is when it's okay to use heat. That's when it's okay to pull out a heating pad or sit in jacuzzi and stretch real good. Why? Because the muscle needs more blood, so we need to infuse it with blood, and one way of doing that is by using a heating pad or a heating source. Now, I will say this, that circumstance is usually about 1% of the time of people that walk into my practice. The other 99% of the time are the people that have injury. So whenever we have injury, I automatically tell people that we should be using ice over the area. Now, there's a lot of questions as far as what type of ice I should be using. Honestly, the best type of ice is full submersion if you can do so, but most people can't. Full submersion is like getting in a tub filled with ice and sitting in it for 8 or 10 minutes. But I know, like I said, most people won't be doing that. But I do know what most people will do, and that is by putting an ice pack over the area or over the region. So if you hurt yourself, the muscles are tighter for longer than 10-15 seconds, then there's a high possibility that we have injury below the muscle, and or we have some sort of rotation happening in the spine somewhere, causing the muscles to become very spastic and tight. So ice should be applied for 10 to 15 minutes. A lot of people ask, well, how long and why? Why are you applying it for 10 or 15 minutes? And the answer is because ice takes time to penetrate down through the layers of skin, through the dermis or the epidermis, dermis, and then down into the actual muscle belly, and even below that into the bone area. Now, anywhere in your body, it should take no longer than 15 minutes to reach maximum benefit. Any longer than that, guys, you're kind of just wasting your time with things. So I tell my patients, if you hurt your back, ice your back for about 15 minutes at a time, and then take it off for about double that time, which would be 30 minutes, and then re-ice and reapply, and keep that cycle kind of going until your pain starts to drop down or the muscles start to relax a little bit. Now, in addition to using a lot of ice, what other things can you do? Well, the first thing that I automatically recommend people do is hydrate yourself really, really well. Because if we did truly injure some of the tissues below the skin down there, the body needs a lot of circulation, a lot of blood, a lot of ways to bring nutrients to the area that's injured to heal themselves. And the best way to do that is to make sure that you're really hydrated. So make sure that you're drinking about 1 ounce of water for every pound of body weight that you are. So 200-pound person, 200 ounces of water. So really probably bump up the amount of hydration that you're doing. The third thing that you can do is some very easy stretches. Now, let's take, for instance, your low back again. If you hurt your low back, the best thing for you to do as far as stretching is just very simple stuff where you lay flat on the ground, you bring one knee to your chest, hug it for 20 or 30 seconds, return it the other knee, and then both knees at one time. This is not dynamic. This is very easy stretching. You're just trying to get the muscles to relax a little bit and open up the tissues so the ice and everything can penetrate down deep. And then the last, I guess the fourth thing that I have here is I want you to try to consume really, really good nutrients that can help with healing. You know, there is a lot of talk and a lot of research out in the world showing that sugar and caffeine cause an increased amount of inflammatory response in the body. So we definitely want to get away from eating those types of foods or consuming those types of sugary nutrients. You want to start looking for things that have anti-inflammatory properties. Things like ginger, turmeric, those types of nutrients that you can eat and you can consume to help drive down the inflammation. Really what this all comes down to is being able to control inflammation. If we can control inflammation, we can get you healed faster, we can get your body moving faster, and your pain level decrease from that. Remember, everything relates and relays through the body. When a person comes in, I always explain to them the relationship between structure and function. Patients walk in with functional issues. Back pain, neck pain, loss of range of motion, decreased sports performance, etc. My job, and what every doctor's job ultimately is how does that relate back to the structure? Now, most people think structure having to do with the localized structure of injury, but ultimately it deals with the structure having to do with the nervous system and the brain, because that's what tells the body what to do. If you injure yourself, yes, localized structures may be rotated or torn or injured, but that's sending signals to the brain, and the brain is thus telling the rest of the body, hey, tighten muscles, compensate, etc. So we start caring for and treating not only the localized tissue, but also the pathways to the brain and back. That's how we get the biggest and best response. Ultimately, that's why chiropractic works so well, is because yes, we get things into alignment, yes, we get things to decrease inflammation, but we allow the body to function the right way. It is the relationship between structure and function, or structure and dysfunction, or lack of motion, lack of function. So by adjusting the body, what we do is we move the body back towards the functional components. I hope that wasn't too much over your head for you guys, but basically it comes down to this. You need to, number one, determine, did I injure myself, or is the muscle just in spasm? Again, if it's in spasm that lasts about 10, 15, 30 seconds, you can apply heat and get the muscles to relax. If it's longer than 30 seconds, then you most likely have an injury underneath that muscle spasm. You want to apply ice. How long? 10 to 15 minutes at a time. Double it while it's off, so 15 on, 30 off, 15 on, 30 off. Make sure you're drinking lots of water. Do some easy stretches, and make sure that you are consuming some really good, high quality nutritionals to help decrease inflammation. Thank you guys for spending the last 10 minutes or so with me. I hope this was useful. If it was, please consider sharing it on your page, or just, hit the like button. I love to see that. So many times people come into my office and they say, Bo, I love what you're doing on Facebook. I love the Facebook Lives, and I love the videos that you're doing. And I say, then why didn't you comment? Why didn't you share it? Why didn't you like it? See, I have no way to tell what you guys are consuming or what you're not if you're not typing in the comments below or hitting the like button. So please, may I urge you, click that like button, or please press share across your pages. Ultimately, guys, I am here to help you with your health, help you with your lifestyle, and help you be a more awesome and better person out into the world. All right, have a great day, guys, and I look forward to talking to you tomorrow. Bye.